Welcome to the lesson on constipation. This is a medium-weighted topic for the exam. Constipation is defecation that is unsatisfactory, because of infrequent stools, difficult stool passage, or seemingly incomplete defecation. Generally, this means defecation less than 3 times per week. In all patients with constipation, an increase in dietary fiber, adequate fluid intake and exercise is advised. Diet should be balanced and contain whole grains, fruits and vegetables. Fiber intake should be increased gradually to minimize flatulence and bloating. The effects of a high-fiber diet may be seen in a few days, although it can take as long as 4 weeks. Adequate fluid intake is important, particularly with a high-fiber diet or fiber supplements, but can be difficult for some people, for example, the frail or elderly. Fruits high in fiber and sorbitol, and fruit juices high in sorbitol, can help prevent and treat constipation. New-onset constipation, especially in patients over 50 years of age, or accompanying symptoms such as anemia, abdominal pain, weight loss, or overt or occult blood in the stool should provoke urgent investigation because of the risk of malignancy or other serious bowel disorder. Patients on medication that cause constipation as a side effect should also be reviewed regularly. Now let's have a look at the treatment options. Bulk-forming laxatives are considered first line after diet and include bran, ispaula husk, methyl cellulose and sterculia. They are of particular value in adults with small hard stools if fiber cannot be increased in the diet. Onset of action is up to 72 hours. And adequate fluid intake must be maintained to avoid intestinal obstruction. Osmotic laxatives are usually second line, and include lactulose and macrogels. They increase the amount of water in the large bowel, either by drawing fluid from the body into the bowel or by retaining the fluid they were administered with. Lactulose is a semi-synthetic disaccharide which is not absorbed from the gastrointestinal tract. It produces an osmotic diarrhea of low fecal pH, and discourages the proliferation of ammonia-producing organisms. It is therefore useful in the treatment of hepatic encephalopathy. Also, advise patients to take plenty of fluids to reduce the dehydrating effect sometimes seen with osmotic laxatives. Stimulant laxatives are used as third line, and include senna, dantron, bisacodyl and sodium picosulfate. They increase intestinal motility and often cause abdominal cramp, hence manufacturers advise to avoid them in intestinal obstruction. Key facts to know is that senna colors the urine yellow-brown, whereas dantron colors the urine red. Dantron is also potentially carcinogenic, so it is limited to use in terminally ill patients. Finally, fecal softeners such as docusate sodium, glycerol and liquid paraffin are also used by many patients. Docusate sodium and glycerol suppositories have softening properties, with glycerol being the fastest acting amongst all laxatives, usually within 30 minutes. Liquid paraffin is no longer recommended because of its adverse effects, which include anal seepage and the risks of granulomatous disease of the gastrointestinal tract or of lipoid pneumonia on aspiration. Next we will look at management of constipation in specific patient groups. First, opioid-induced constipation is always treated with a combination of a osmotic laxative, usually lactulose, and a stimulant laxative, usually senna. This is a key point to remember for the exam. Naloxegol and methylnaltrexone bromide are used if this is insufficient. Methylnaltrexone bromide is also used in palliative care as an adjunct to existing laxative therapy. Constipation in pregnancy is common and bulk-forming laxative is the first choice if fiber supplement fail. An osmotic laxative, such as lactulose, can also be used. Bisacodyl or senna may be suitable if a stimulant effect is necessary, but use of senna should be avoided near term or if there is a history of unstable pregnancy. Docusate sodium and glycerol suppositories can also be used. Constipation in children requires the use of a laxative in combination with dietary modification or with behavioral interventions. Diet modification alone is not recommended as first-line treatment. Macrogel is used as first line and if insufficient, a stimulant laxative is used. If stools remain hard, lactulose or another laxative with softening effects, such as docusate sodium can be added.